Welcome back, everybody. It's Ask the Expert. We've got more questions on a lot of them, by the way, that to do with replacing teeth and moving teeth around at Deschenes Poitras. Now, you do the initial consulting, and then you move on depending on what has to happen, right?
According to their needs and the condition in their mouth.
Yeah, because you know people who do this, that, and the other thing, or you do it depending on whatever the issue is. Okay, we got an email question first or phone call? Ima?
Yes.
How are you?
Hi, good.
Very good. What's your question?
Yeah, I was born with a gap between my front tooth.
Yeah.
And like it goes back generations. And every time I go to the dentist, they ask me, do you want to fill this?
Right.
So I was just curious, like, is it important to have this filled? Is there any dental reason I should have it filled or not?
How old are you?
38.
Okay. Is it important to you?
Exactly.
No, it's not important to me.
No?
Okay.
Well, they just they ask you because
you
it's
answered your own question.
Well, at your age, you are all adult teeth, and your bite is probably stable, and this gap will probably never close on itself.
Right.
The question is, are you comfortable with yourself?
Yeah. Some people like it.
Yeah, having a gap, it's kind of personalizing the way you are.
Yeah, and
it's part
sometimes
of you.
it's very attractive depending on the person,
and sometimes
right?
it's very attractive. So the real question is, are you comfortable with yourself? Do you want to close it or not? If yes, well, there is option. If no, big deal. Lots of people are happy.
You got to be careful. Some people ask to close it with white filling or veneer or something like that. The problem is that if the gap's big, the two teeth are going to end up so big in the front to close that space. You look like
and that space, if it's big enough, won't be supported, right? So you'll have problems later on.
Exactly. So it's better to sometimes do braces to close that space.
Edie's on the telephone. Hi, Edie. How are you?
I'm fine this morning.
Very good. What's your question?
I have just lately I've got this. I've always had crooked teeth, and I come from way back when they didn't put braces on.
Yeah.
And now I just lately I've noticed that it feels like my gums are receding.
Right.
I got a loose. One of my crooked teeth in the bottom is loose.
Yeah.
And there's like a film coming off it all the time.
A film?
Sort of like
over your teeth.
Yeah, like I can feel it with my tongue all the time. It feels like they need to be cleaned. They're brushed, but.
Oh yeah.
And I don't know if it's gum disease or.
It's a good question, though.
Yeah. How often are you seeing your dentist?
I go every 6 months for cleaning, and they take the plaque and all that off it then.
Good. And are they checking the pockets? Like, are they probing around the gum and check where is the bone level? How's the gum?
They do a bit. Yes, a bit, but.
Because usually we don't have any mobility in back teeth. They are supposed to be very solid. So if there is any mobility, I would get it checked, because it can be either an abscess related to the tooth or really a gum disease, something starting, bone losing and...
Yeah. Isn't there a measurement that you guys do of the gum itself in relation to the tooth?
Yeah.
That's called probing, where you measure the
That's what you're talking
between
about.
the gums and the tooth.
Yeah, and how often should you do this?
Once a year.
Once a year.
Should be done completely on all teeth. Once you're an adult, you don't do it on any kids 18 and over.
Yeah, usually there's no issue, and you just record that information, correct?
Yeah, just to monitor the bone level, to make sure that with age, with time, it's not going to melt down, and make sure the gums stay healthy. I mean, we're not checking only the teeth, we check everything around it.
And abscesses could be chronic abscesses where it won't hurt, but there's an infection there all the time. Could come from the gums or could come from the tooth itself.
Yeah. And what should Edie do in her case then?
Go see a dentist.
Just
figure out what's going on.
Go back to her dentist and say, check my gums.
And a lot of patients that have gum disease are seeing that they're coming to the office every 3 to 4 months instead of every 6 months.
Right.
It's covered by insurance, or we ask for more coverage from the insurance. Yeah. They're not seeing the dentist every time. They see the hygienist and getting their teeth cleaned more often.
Is gum disease one of those things that can pretty sneak up on you? Like,
yes.
The next thing you know, you've got an issue.
Yeah. And it starts like that, like wiggly teeth and something coming out on the side of the gum, the pus or infection.
Yeah, and it can happen. I mean, it's nothing to be ashamed of. It happens to people, right?
It's common.
Yeah, and it doesn't hurt. So quite often people say it doesn't hurt, we don't do anything.
Yeah,
well,
so
when
unless it hurts,
it's too late.
Yeah, but if you notice, I know, a lot of people say if their gums are bleeding easily and things like that.
When you wash your hands, do they bleed? Why, when you brush your teeth?
No.
People say it's
That's a good
normal.
point.
Oh yeah, it's
To have a
just
little
bleeding
blood.
a bit. Yeah.
No.
Okay, if your hands were bleeding a bit, would you do anything about it?
Yeah, true.
Yeah.
True. We have an email question. That's fire that. Can you use an existing tooth that is about to fall out as a crown, or for the mold? So how do you? Yeah, that's a good question. How do you make the tooth that's being replaced? Like, how do you know what?
Temporarily, you could use an existing tooth. You cut off the root, and you could use it as a temporary measure to replace the tooth. Very temporary.
Or we can send it to the technician who, those people are real artists. Like they build
sure
it.
are.
Oh yeah, they build the teeth.
Yeah.
It's, I mean, if
They'll be
one
able to
day you
match
have
it.
a chance to visit a dental lab, they're working on one tooth at a time, and they're building it. They are characterizing it. It's a real
They
art.
make it to match
Yes,
the
yeah.
existing
yeah.
situation.
And some people
right?
send we can take a mold to send it to the technician so he can really copy what he had, what the person had.
Yeah.
Or we can send pictures. Some people bring picture. I want my teeth like that.
Yeah, and the color is always matched.
The color is always matched. Yeah, yeah. So I mean, to build a case, it's a team. Like sometimes we need surgeon or a specialist, and the general dentists are usually the one who's in between everybody and coordinating everything to make sure the patients stay happy.
Using the existing loose tooth, usually it's very temporary.
Yeah.
Take a mold and know the shape of the tooth.
Yeah,
That's about
you
it.
guys know what you're doing in that field. I think more than anything, as I pointed out earlier, getting to a dentist and getting a consultation on your situation is probably the most important thing you can
It's
do.
the most
Yes.
important thing.
Yeah.
And go to see somebody that you would trust. That's the main thing.
Yeah.
Because this person will be in the middle. And then you will always refer to this person.
Yeah.
And then the dentist will talk to the specialist, will talk to the surgeon, will talk to the technicians.
Well, I noticed a couple of questions here where people maybe weren't getting the best advice for their situation. So it's okay to go have someone else look at your situation.
Absolutely.
It's called a second opinion, and there's never anything wrong with that.
Yeah, nothing wrong with that.
Listen, there's the address, there's the phone number, the information to get in touch with Deschenes Poitras. Book yourself a consultation if you need a replacement tooth or anything of that matter. I mean, your teeth are important to you, obviously, so make that commitment to find out what your issue is and get it dealt with. Thanks, you guys. Pleasure.
Thank you very much.
Thank you for
All right, we'll be back with more of CTV Morning Live, Pinterest with Melissa Lamb, and there's some action in the kitchen, I do believe. It's 9:41. We'll be right back.